Okay, welcome to the podcast today, guys. Today we're going to take on a topic that is really near and dear to me because I've always had a great respect for the mind-body connection. And obviously, all day I work with the body. As a chiropractor, I'm adjusting patients, giving them dietary advice, exercise advice, and it really is, more of a body approach. But my respect for what goes on in the mind and its effect on the body is massive. I have done things in my own life to improve my body through my mind and vice versa. It's a two-way street. The idea that they're actually separated is really just a semantic nightmare because they really are only separated in small amounts. I would say a small percentage of us is just mind and a small percent of us is just body. Everything else is intertwined in ways that you really can't separate. And if you look at the different healing disciplines throughout the world, most haven't really separated them. Chinese medicine really hasn't separated them. It's thought, I looked this up years ago, that when the scientist became very knowledgeable, he approximated the knowledge of the other most knowledgeable person in the group, which at that point was usually a religious individual, a priest or a shaman or something of that nature. And when that happened, the battle over who knew more happened, and it became sacrilegious in a sense to know more than what the priest knew or a spiritual advisor knew, because that person was a direct descendant of God. And that became a dangerous thing for a scientist to do, and scientists were killed, burned at the stake, all kinds of crazy stuff went on. So the church decided, from my understanding, to separate the two and say, okay, we'll kind of give the body to the scientist. He can do dissection, he could do chemical, drug, and herbal experimentation, and the mind will stay in the hands of the religious leader of that area. And although that was probably a great solution at the time, just to keep everybody sort of calm and to keep a good understanding of the two, it puts them as different disciplines to be studied, like little watertight containers that you can take a good look at. It caused problems later because now we're in an area where we're seeing how connected they are, and that we really all need to work together as a team and understand we each have our disciplines or expertise. So today I want to talk basically about mental health as much as we can. It's a great year to be talking about it. Everyone's suffering and miserable and angry and fed up and like I've never seen. And we're all struggling, I think, to some degree. And the more help we can get at tackling this massive topic, to do it in one podcast in any reasonable manner is kind of crazy, but we're going to do our best to sort of sum it up. Today, I have someone on the show that I have great respect for. I've got to know her over a few years. And I'm just going to read her bio to you because, it's just loaded with, she's like the perfect person to have on today. She is a licensed mental health counselor, master's degree from the University of Buffalo, trained in trauma therapy, including EMDR, which is something I got fascinated with years ago. We'll talk about that because not everybody knows what that is. She's currently working in the city of Buffalo with a focus on healing from childhood trauma and attachment wounding, in addition to depression, anxiety, OCD, and behavioral concerns. Welcome to the show, Jessica Olunga. How are you?
I'm great. How are you, Mike? Thanks for having me.
Thanks for coming today. Appreciate it. I just want to go over a little stats with people. The most common form of mental illness or mental challenges or challenges to our mental state is depression. I looked up as far, and you can tell me if you feel otherwise, but 16.2 million adults, 10% of people between the ages of 18 and 29 years old suffer depression. And I have a favorite definition because from my understanding, Sigmund Freud invented the word, and he said it was internalized anger. And I looked up some other definitions. One of my favorites is by Jordan Peterson, who I absolutely love. And he said it's the inability to formulate a possible future. And in moments when I felt depression, I thought, I can't formulate a possible future. I can't figure out what I'm going to do with this situation. I can't imagine the future. You think of when you lose somebody, how am I going to deal with that loss in the future? What's the future going to look like? 51.5 million adults in general are diagnosed as having mental illness. And then you get to the point where the second leading cause of death in 15 to 24-year-olds is suicide. So a horrifying number there. 20 veterans a day commit suicide. that number to me was devastating. My father was a vet. He was traumatized training for the Korean War. He had a serious head injury, and he dealt with the ramifications of that. He self-medicated with alcohol at times. He overcame most of it. He's an amazing man. But I thought, I'm very close to the veteran experience, even though I am not one. So I don't pretend to know that much. I don't know it personally, but I know it one person away, my own father, and then friends and patients I have. So I have some connection with them, put it that way. One more thing about suicide, it's 3.8 times more common in men than women. So it's a much more common thing. And as men get older, it's even more common, which I think is even more devastating. But let's get into some answers. And let's talk about some more positive things we can do about this. And as you mentioned just before we started taping, some existential things, which is one of my favorite topics, obviously. So what got you started in this field? Talk to me about what drew you in.
Yeah. Oh, so I think that what drew me in, what got me started is probably different than what keeps me here. I was working, I don't even know that I've shared this before. I was working in like a corporate sort of job. I was a systems analyst, and it was a very not connected, not relational sort of job. And there felt like there was like something missing, something really empty there for me. I during that time formed a lot of relationships where there was lots of connection with coworkers, but almost in a way where like what I looked forward to at work wasn't the work at all, but like this relationship with people where we could talk about the real things. So, oh my gosh, my teenage son is going through this, and as a mom, I'm in anguish and I don't know what to do. And, like kind of sitting down and connecting with people at that level with what they had going on. And so I like really found meaning in that connectedness and that sharing of difficulty and sitting in that space with people where it's like, I'm sharing with you the hard things, the real things, the raw things, and kind of sitting in that space. And that felt very purposeful to me. And so that job ended. Instead of pursuing a different job, I decided to go back to school and went into the mental health counseling program at UB. I didn't know exactly, I think, what that would look like from an education level or anything like that, but I felt like, oh, okay, I can help people. But to get a little deeper and be a little authentic and raw, I think that anybody in the mental health field would tell you that they're in the field because it's a place they've been, where they've struggled, where they've had to do work on their own stuff, whether it's been severe pervasive mental illness, trauma histories. And so having gone through a lot of the journey where I was healing, and I'm always working on that, that's not a done thing. It draws you in because it's like, oh, wait, it can be better. Like this life can be better. I can be better. Like I don't have to stay stuck here. And why wouldn't I want to help other people also not be stuck here? Like there's a lot of, evangelizing of like, I'll tell just about anybody like, hey, have you thought about seeing a therapist? Because I just like, it's been such a positive experience. I've changed and grown so much through my experience that I want to kind of keep that going. And then to continue on, I just have, because of where I was working, I was exposed to just a ton of traumatized patients, both from the aspect of like war-torn countries and a lot of refugee population, a lot of things like refugee camps and imprisonment and torture, but also chronic developmental trauma from growing up on the east side of Buffalo in systemic oppression and, family histories of mental illness and abuse or neglect or things like that. And just to make a quick correction, that can happen anywhere. It doesn't have to be the lower income areas, but that's where I was working. And so I've learned more and more about really healing those traumatic wounds, those attachment wounds from our childhood. And I'm just fascinated with the field. I am amazed at watching people overcome stuff that has been weighing them down and holding them back for their entire lives. people come to me and we start talking about stuff. We start uncovering things that happened 40, 50 years ago. And they can heal from that. They don't have to keep holding it. They don't have to carry that anymore. So that's
fantastic. No, I mean that I think like it's like a calling. You went to work. I love the way you tell that story. You went to work, and it wasn't the work that was drawing you. It was actually you're wanting to have deeper relationships and counsel people, and just be a full-fledged human being, and not just a tool for numbers or marketing or something else. Not there's anything wrong with those careers, right?
no, if you're called to those are great.
Exactly. I have plenty of friends that are engineers, and they really don't want to get into anything that you and I could talk all day about. They want to solve problems, put rockets on the moon, and thank God, because I love when my car works. And Star Trek was one of my favorite shows as a kid, and it's still to this day fascinating. So I have a big part of me that's an engineer, as well as someone who's out solving these kind of issues or getting involved in these kind of issues. And I agree to be called in at any point in your life to find out what your calling is, and then be able to go out and do it is a blessing. And hats off to you for following it, because a lot of people won't do that. And I think that's a testament to you, your honesty, and your want to help. I mean, it's just an amazing thing to be able to like celebrate people's victories. So first question I have outside of getting to know you for my viewers is, why are we so unhappy? I just want to touch on one thing. The Dalai Lama came here, and they asked him a question after he toured the country, maybe 10 years ago, whatever it was. And that someone asked him, what's different? What's surprising to you about what you've seen here? And he was just saying what a big and beautiful country it is and everything else. And the thing that shocked him the most was how miserable we were, how depressed and unhappy and anxiety ridden we were. He wasn't like expecting that. And I thought, what an interesting observation for someone from another country. I know when I've traveled, you see the way other people live, and you sometimes see their joy. And he came here in a sense, saw our misery. So why are we so unhappy as a culture? Why is our, in this year or other years as well?
Yeah. So first, I don't know that I can follow the Dalai Lama, but as far as like, but I think it's clear that we're unhappy. I think that that's something that somebody who would come here would absolutely observe. And there's a lot of reasons. This is a really existential question, and we're not going to be able to delve kind of all the way down into that. At one point in time, our meaning and our purpose was focused on having to survive. And I'm not necessarily going back all the way to like our Paleolithic ancestors, but even just a few generations ago, you really had to work to survive. And that kept you really busy. Like and there's a lot of meaning in that. And I think that as we become more affluent as a country, and I know there are areas that are less affluent, but as we've become more affluent, as things have been easier to access, I mean, I can right now, if I want a steak, not only can I just go and get it, I can order it and have it delivered to my door in the next couple hours. Like there's no, like everything is, it's like I have this expectation of immediate gratification. I don't have to work for it anymore. Not that I don't have to work for the money that I used to pay for that or anything, but like it no longer consumes us. And so a lot of people are missing having this meaningfulness or this purpose to their day-to-day activities, especially if they're working in a job or, like I think about, and I think about people who are working jobs that they just are like very menial, they're doing the same thing repetitively over and over again. And they're not feeling satisfaction from there. They're not getting like, they're not feeling like their purpose is fulfilled in that. And if they don't find that elsewhere, if they aren't really intentional about that, I think that just kind of leads us to this place where we're stuck in ruminating thoughts instead of occupied with fulfilling purpose. And so I think that that's a huge piece of it.
I think you make a great point. And one of the things that I've saw that a lot of people will feel they have a job, other people feel they have a career, and a job is not always as pleasurable. But on the other hand, when you have survival is your main instinct, you have to incorporate all your thinking. And obviously that can be to the point where it's detrimental, but it really involves some core base stimulating and I think very healthy things. I mean, why do people still hunt? You know, you can talk about all the philosophies and being vegan or being a carnivore, and then but all that aside, why is there still this drive to go out and do that? Or why do people run ultra marathons? Why do people cross the Atlantic Ocean in a rowboat? You know, these really sophisticated boats that go across the Atlantic. It's so primal what they're doing, and they seem to crave this, and that craving makes them happy. So to some degree, I see where you're going with this. I mean, it really is when you have too much given to you, or you have too much leisure time, that freedom can go either way. You can develop your society like the ancient Greeks did, or you can go off on tangents and not know, why am I getting out of bed? Because I don't have it. There's nothing to really get me going. There's no, and to me, it goes back to purpose, right? To me, the strongest, one of the difference between people who survived in concentration camps and people who survive cancer and heavy illness, oftentimes is how strong is the purpose they have in their life? What do they still have to accomplish? And how ferociously do they get out of bed in the morning?
Right.
You know, are they dragging and sliding and laying on the floor?
Yeah.
Right. Or are they getting up and they're ready to take on the day?
Yeah. And to follow that, I don't think that boredom is necessarily a bad thing. I think too much boredom is a bad thing, but like, it can also be the space where we're really internally reflecting. It can also be the space where we're able to creatively solve problems because we aren't focused on the day-to-day stuff. So if we always lived, let's go all the way back. If we always lived in a Paleolithic sort of hunter and gatherer state, we never would have Zoom. Like we would never got there. There was never the creativity, the time, the space to develop more advancements. So it's not all bad. It's just bad when we fill it with the wrong things. It's bad when we try to escape it. Oftentimes boredom means I'm sitting with my thoughts. And if I can't handle that, I'm going to medicate myself in some way, right? Either literally or with social media use or alcohol or food or whatever it is, so that I just don't have to sit in that uncomfortable space. And that actually, and I'm sure we'll talk about it more in depth, but that just perpetuates the negative stuff that we're stuck in, like the thought patterns. And
exactly. And it leads right to the next question I have. What causes all the anxiety? I hear people reporting to me constantly the anxiety they feel. I don't have a propensity for anxiety, I guess. It's not something I suffer, certainly as an anxiety disorder, which I looked up the difference between two, because obviously anxiety is natural in certain circumstances. It's healthy. It's part of a survival mechanism. But when it's a disorder, it's dealing with, it's causing problems in your daily routine. The anxiety is not allowing you to just do daily things in a healthy, maybe vibrant or efficient manner. So where do you think all the anxiety is coming from? It seems to be going through the roof in our society today.
Yeah, well, I like to look at anxiety from an evolutionary perspective. Like you said, like it's a survival skill. Oftentimes when I'm working with people, I tell a little story about like a cave person, and like if caveman Mike was walking through the jungle and a saber-toothed tiger jumped out in front of him, he would need to respond to that. And so what happens is in an instant, our nervous system, we assess that we're in danger, a little red flag goes up in our brain and our nervous system switches. Our nervous system has two purposes: rest and reset sort of purpose, and then stay alive sort of purpose. And so I'm just walking through the forest or the jungle and I'm feeling good. I'm in rest or reset. The saber-toothed tiger jumps in front of me and I switch. My nervous system switches and now I'm on high alert. And adrenaline and cortisol are running through my body. I stop worrying about things like hunger or, rest. I don't need to sleep right now. I run like I've never, I decide to run. So I look at the saber-toothed tiger. I'm not going to fight the saber-toothed tiger. I decide that I can try to outrun it. Right. So I run as fast as I can and I cut my leg on a branch and I don't even feel it. Like I don't even know that I cut my leg, right? My body stays in that state. Now, the evolutionary purpose now, or the evolutionary flow of how this would happen, is that I would either get safe from the saber-toothed tiger or get eaten by the saber-toothed tiger. And this whole
Mm-hmm.
thing would last a couple minutes, right? So this switch in our nervous system of you are not safe is where anxiety comes from. You're not safe. You've got to function differently. Now, our body evolutionarily is a little slow. And so you're not safe as in my boss is going to be really angry if I don't finish these reports by the end of the week. Doesn't necessarily feel a ton different than, oh my gosh, the saber-toothed tiger is going to eat me. So we have like this chronic anxiety that happens. All these things through our lives shift just a little bit more adrenaline, a little bit more cortisol in our body. And as you were talking about before, now we've got physical effects of that because that hurts, right? We have inflammation in our body. We can't digest food because our body thinks we're not safe. And so when we see that, when we get that reaction and our nervous system switches and stays there or stays there much longer than it should at least, instead of going back down because, oh, I'm safe from the saber-toothed tiger. Now I can breathe. Now I can relax. But I'm never safe from the reports that are due at the end of the week, right? Or it goes from, oh, it's the reports. And then it's like, oh, I've got to do all this stuff. So we have this onslaught of stressful things that shifts us and we stay there. And so we have that impact. And we, when people describe anxiety or panic, they'll say things like, my heart is racing really fast. My muscles are really tense. I'm sweaty. Yeah, because you're ready to run from the saber-toothed tiger. But that's not really the reality we're facing, right?
No.
So it's this onslaught of all of these stressors. It's a lack of spaces where that isn't, because oftentimes we go from stress at home to stress at school to stress at work, and we repeat the cycle. We don't have things that allow us to release that, to get out of that space. And we just, because of technology and all of the conveniences we have, we are able to take on more and more things. And so we do. As opposed to like a couple generations ago where you had to wash the laundry on a washboard in a tub of water, so that we knew that was going to take our time, and no, we couldn't do something else while we were doing that. And now it's, we keep being able to do more things at a time. And I feel like that just kind of increases that.
Yeah, I think you just answered it very well, and especially in the last thing you said, that technology is allowing us to be so connected that we don't really have time off from these stressors. And that could be, I remember years ago, before social media was invented and technology was still rocketing through, they asked workers in general that were at their computers, many people sitting in front of their computer, how is technology serving you? And they said, I'm twice as efficient and 3 times more stressed. So I'm getting twice as much done, but I'm 3 times more stressed. And that was before you could take it home, Zoom it, fax. I think you probably faxed at that point, but you certainly couldn't email too many things. And you had to be off. When you were gone, you were gone. So if you're at the water washing clothes 100 years ago, it was pretty hard to figure out where everybody was and what they were doing, and they couldn't contact you. So you can get into maybe the rest state, right? The parasympathetic nervous system could take over, and you could kind of get in a trance and wash your clothes, and it was kind of peaceful. And if the saber-toothed tiger showed up, you can switch over and deal with it in the best you can. But at least you had, moments at least, or maybe hours, maybe half a day, where there wasn't anything that was pulling you from that sort of almost meditative kind of parasympathetic dominant healing state. And that leads me right to the next question, because, the effect of social media. I mean, we're really actually already talking about it. I remember hearing that Selena Gomez, that the singer and actress, quit all of social media because she was dealing with depression and anxiety. And I thought, that is an incredibly interesting thing to say, because that's kind of one of the ways she made it. Like the stars of that age use social media masterfully to create a connection to their young fans who were on this technology before people my age were on it. And they felt like, hey, we got this thing going, we got this communication network going. And what brought her, part of what brought her to her fame was that. And then she just quit it all. And I thought, wow, what a smart move on her part. What a risky thing to do.
Yes.
It could be like almost a career suicide type of idea. I
Yeah.
can't imagine what her management said about that, but she was strong and brave enough to do it. I admire her for that. And it's something that I have one of my older nieces did. She just took a break for a week from all social media. She basically said, I'll see everybody next week, take it easy, and took a whole week off. And she said for the first couple hours, she felt like she was going to pass out. And then a couple days go by, and she started noticing things when she was walking. She took this walk every day or every once in a while, and she started noticing things about trees and houses and clouds, because normally she was on her phone, maybe walking into traffic, for God's sakes. So it's really once again, technology. We have to adapt to technology. We have to be
Mhm.
able to know when do we shut this off, and what are the expectations. Everybody at my office knows, anyone that knows me knows, when I'm seeing patients, I'm not looking at my phone. I'll check it at lunch, and I'll check it at the end of the day. And my wife and children and my mother knows, if they have to get a hold of me, they'll call the staff, and they can come and interrupt me from a room if something horrible is going on that I need to know about. And that works pretty well, because it would be ridiculous to be fussing over my phone while treating patients. And I hope all doctors are doing that the same way. So what do we do about social media? Do you think taking breaks, like a 1 week break or a 2 day break,
Mhm.
maybe announce it so people aren't thinking, oh, they're ignoring me?
Yeah, yeah.
I
It's
mean,
interesting. I didn't know that about Selena Gomez, and that is incredibly brave. And how awesome that she decided to prioritize her mental health over her public image.
mhm,
But also how many young people that might have impacted in a positive way, because they
right.
see like, oh, if she can do that, maybe I can do that. Or if she thinks that this is really having an impact on her, maybe it's having an impact on me. Because I'm
Yeah,
certain I'm certain those teenagers and young adults' parents have probably said that, but they're not going to hear it the same way. They're going to hear it from somebody who they admire,
correct.
like a star like that. So
Absolutely.
that's amazing. I'm very, very impressed with that. Well, there's a few things. Limiting our time on social media and limiting what we're following on social media is huge. And it sounds really easy. When I work with people, nobody ever likes these answers. At least 2 hours before bed, all of your electronics should be turned off. It's just
Hmm.
good for your sleep cycle. It's good self-care. We bring what is on our mind into bed, and so if we're sitting here and we're like consuming information, we're not going to be able to rest, right? Um,
Yeah.
I and I think that social media has a lot of really great positives. And so I don't want to just play the negatives. I want to just like bring up, like, there are so many support groups out there. There are, like,
Hmm.
on
Yeah.
Facebook, there are ways to get connected to things that you're interested in but don't have a connection to. If you're in a more
Hmm.
rural area, you can get exposed to life outside of your kind of limited space, right? Or
Hmm.
any homogenous sort of area, like you can get exposed to things. I think that with like school being online too, recently we figured out like these ways to like expose ourselves to new knowledge and new ways of learning. And I think social media can be a really powerful tool in that. So when we're using social media wisely, it can be a tool. When we're not using it wisely, we're it's using us as a tool, right? Exactly. Like
Correct.
that's its purpose. Um, and some of the things that are really horrible there is like that inadequacy, that comparison stuff that happens. I know that
Mm,
happens a ton in the entertainment business, or even like social media influencers and things like that. It's always about like what else is out there, or we're sitting on our couch eating a bag of potato chips after a rough day at work, and people are posting about the good things that have happened because that's what you post, right? So
mhm.
somebody's like posting a picture of something like they're playing in the yard with their kids and everything's perfect and the sun's shining, and it's like it's beautiful and it's great and it's true, but that's just one picture of their day, and we're comparing our whole day to one picture of their day. I use this example
Right.
often. I knew a person, a friend of a friend of a friend sort of thing, who had posted this beautiful bouquet of flowers and said, oh, my husband is the best husband in the world, or something like that. And because of the connection that I had, I actually knew what was going on. And the husband had had multiple affairs. And like he was kind of, I think, trying to smooth things over, fix things, repair things. I don't know. And I don't even know what ended up happening with that. But But like the reality is, somebody who doesn't know the story is watching that. It's like, oh, my husband never buys me flowers like that, you know? And
That is a good
like
example. Mm-hmm.
we're comparing what we see, which is with what people are presenting, to our reality. And that's an unfair comparison. That's apples and oranges.
Yeah. I
So,
was told a while back that Facebook, for example, is like a highlight reel of someone's life, not an actual representation of
yeah.
their life. And I think, and that's fine. I don't think people are, well, some people I'm sure are doing it on purpose to some degree, but it really is just, you really want to advertise your most miserable aspects of your day. I don't think some people maybe want to do that, but most people would just want to say, hey, look what happened. I climbed a mountain, or there's a new baby in my family, and all the wonderful stuff. And then your life is like, well, I didn't climb a mountain and I didn't have a baby. And people start feeling bad about themselves, but you don't realize, there's a whole story there. And I think it's just our nervous systems have to, and our minds have to wrap around how this stuff works. And like you're saying, evolution is a slow thing. So we are still processing information in a real world, and then the virtual world comes along, and we don't know how to separate what's real and what's not.
Right, exactly. And
It's
kids
sad,
younger and younger are using it, and as they're using it, like their frontal lobe isn't even fully developed yet. So the people who are like the main targets of this are not able to, especially if it's been their whole life, are not able to really draw that clear line of reality versus not reality.
Right.
And we often use social media, and I think this is like the biggest space where it can be really, really, and we can be unhealthy in a lot of ways, but we often use it as a distraction, but we do it to avoid our own selves, right? We do it to avoid our thoughts and feelings. We use it like a drug, and we dissociate a little, we check out. And so, I'm sitting here on my phone and I'm scrolling through. I'm not really even absorbing stuff most of the time, right? I want to do anything to not feel what I'm feeling, and I'm using it to kind of distract myself from that. I check out. Maybe I get a dopamine hit because somebody liked one of my posts, right? And we know that actually releases dopamine in our brain. Yeah. And so now I need more of that. Give me more of that, right? And now we have a cycle. It's an addictive cycle. It's just like drug use or alcohol use, and it's not easy to break, which is, we were asking earlier, well, what do we do with that? We limit, for sure. There's a lot of self-reflection that has to happen in order to use social media in a healthy way. We really have to say, what are my values? What do I believe about this? What do I want to get out of this? What am I seeking, right? Am I seeking validation from people, and who? Right? Like, am I looking for connection from people, and who? And what are some other ways to get those things too, right? Like, really, when we want validation, do I want it from Susie that I went to middle school with? No, but I still get that dopamine hit, right? Who do I want validation from? Those deep, meaningful, intimate relationships in my life, right? I'm not going to get that by scrolling on Instagram, seeing who liked my latest photo, or, things like that. Oh, I got a new follower. Yeah, we get a dopamine hit, but we don't make real connection in that space. We don't get what we're actually looking for.
Yeah, it's a different world. And I think one of the things when I was going to chiropractic college, we had our pharmacology professor, and he was a pharmacist. And the first class, he said, let's define what a drug is. And he was doing it on purpose to sort of like get a perspective on what a drug is. And I was in class with Dr. Fred Cleary, who's one of the people that've been on my podcast 3 times now, because he's such a spectacle and an amazing guy.
He's an amazing speaker. I've listened to those. Really interesting stuff.
Yeah, and one of the things and this is exactly what you would think you do in a class like this. Anybody that's seen any of his podcasts here is, let's give some examples of drugs. And he put his hand up first, and he said a cheeseburger. And we're like, what? Now he has, I don't know, I wouldn't say he has eating disorders. I don't know if it's ever been diagnosed, but he's been all defeats because of competition, really. And he and I could eat a lot of food. We'd go out to eat incredible amounts of food at times, and then have crazy workouts. And the professor said, absolutely correct. It depends how it's being used. And he said, yeah, what if I eat 6 of them because I'm sad? right? And then we got to find white sugar. And then the degree to which your physiology is shifted and the degree to which something is natural, you put those two together because you can, herbal product couldn't kill you. There's mushrooms that can take you out. So it doesn't that it's just unnatural. You know, there are natural drug-like states. So saying what is a drugged state, and then what is being used as a drug? Social media, the dopamine release, right? Pornography. There's a lot of things people use to escape their state and to try to create, a chemical shift in their mind. And a drug-like thing, you could say that exercise could be used that way. So then you can get into what's healthier and what's less healthy ways of creating your state. And is there anything wrong with creating the state that you're in? I don't think it's certainly not always a bad idea to take yourself from a state that isn't serving you and creating a healthy behavior that then changes your state to something more productive, right? So,
Well,
for me, that's part of it.
yeah, and I would agree with that, with like a caveat of we have to learn how to be in the other states. We have to learn how to acknowledge and validate everything we're experiencing, which sounds a little kind of woo-woo and out there, but like as a therapist, especially with a trauma approach, we're supposed to experience all of the emotions. That's part of the life experience.
Yeah.
We're not supposed to, you ask what makes us happy. My goal as a therapist isn't to make you happy. My goal as a therapist is to get you to a place where you can feel, experience, and sit with all of your emotions while not being in a hyper or hypo-aroused state, right? I want you to be able to be sad when sad is the appropriate feeling, right? And I want you to be able to sit with that. I want you to be able to experience sadness and know you're going to be okay. It's not, the sadness isn't going to kill you.
That's great.
Yeah, and so it's not about.
I think something like that needs to be said more, that in counseling, you can be taught to be able to sit with your emotional state, and it's okay to do so, experience it, and grow from it, learn, and move on. Like process what you need to process, because that state is natural, but how long are you there for?
Right.
If you're there 6 months, 3 weeks,
Yeah. And how to, like, our emotions are kind of like a circuit. They have something to do. They're telling us something. They're saying something to us, and they're supposed to be completed, right? Like, and when we don't let ourselves feel it, we're cutting it off and we're not letting it complete. We're not learning what it's trying to say. We're not experiencing what it's trying to say. And when we do that, it just stays kind of unprocessed within us. And so now we're actually going to hold on to it longer because we haven't done what it's supposed to do.
I had a patient who at age 13 started drinking, became a full-on alcoholic, and I think in his mid-30s went to AA and gave up and stopped drinking, and then counseled people. He's an amazing person. And he told me one time that he emotionally was frozen at age 13 for years because he felt that the alcohol had him escape processing and growing, and he had to grow up again in a sense. He looked his age and everything, but he certainly had emotional delays because he didn't really process his emotions. He drowned them in alcohol and moved on and just kept going forward without the proper work, I guess. And that always stuck with me as an interesting story. Like, how often are we also doing that with other things? I mean, he was doing it obviously in an extreme manner, but how are we doing it with social media? Are we doing it with just plain, over entertaining ourselves, over exercising ourselves, over just making our lives so busy we don't have time to like what you're saying, sit with your emotions and let them grow you, right?
Yeah, which is hard. It's not an easy process.
No, it's no fun.
It's no fun. I always, one of my taglines in therapy is, "This is hard, but it's good," right? Like a lot of really good things are really hard.
Yes, 100% agree. One of the things I want to get onto, and I got a crazy question for you based on that, is whatever happened to the frontal lobotomy? Now, the reason I'm asking this question, not just to be goofy, is obviously it's horrifying and goofy at the same time.
Yeah.
But you think about the treatment of mental illness over time. The Buffalo Psychiatric Center used to be called the Buffalo Asylum for the Insane. So the verbiage has changed. It's become more polite, like a lot of things today. And the treatment changed. And to me, the treatments appear to me to be getting better all the time.
Yeah.
And I saw a show on, I was listening to a show on NPR driving home from work one day, and it was about ice pick lobotomies. And the best part about the show was it was examples of success stories with it.
Mhm.
And it was the interviews of children whose parents in the 1930s had ice pick lobotomies, and then what they were like as parents following that. And they had said that
Mm.
this technique was not, and I looked it up and it said it was abandoned because of mixed results, which
Yeah.
I thought was a polite way of saying it. But obviously we came up with better ideas.
Yeah.
But the idea that it actually worked at all, and that these children claimed that their mom went from screaming and crying on the floor all the time to happily making them sandwiches, probably a step in the right direction. But obviously if she's just happily making sandwiches all day, there's something else wrong. Obviously they did a little more work than they should have.
Yeah.
But in your mind, taking it just as an idea, if you want to talk on frontal lobotomies, feel free. If not, ask, get into how things have changed, like
Yeah.
what's the direction, and what do you see for the future maybe?
Yeah, yeah. Well, there's a couple things with like the lobotomies too, and like this is just like my grad school education. Have never been involved in psychotherapy or psychosurgeries or things like that. But
Mm-hmm.
what I find incredibly interesting is that there was a very clear connection between our personality, our behavior, and our brain, the part of our body,
Mm-hmm.
in a way
Mm-hmm.
that there's actually, and this is kind of fascinating, but there's evidence of lobotomy like things having happened by like shaman, like thousands of years BC. So this is, maybe it's like newer in the medical world, but there's always this idea of that. And obviously some of the results are absolutely horrifying and some of them were okay, right? But the alternative back then, like you said, like the Buffalo Asylum for the Insane, was institutionalized, horrible, like where people were in straitjackets and restrained and like not treated like human beings at all. And so the lobotomy actually seemed like, oh my gosh, there's hope. It was
Right.
ultimately fell out of favor because we did start introducing drugs that were having much better impact, much less of the horrible side effects. And I don't, if anybody doesn't know what a lobotomy is, they pretty much would, ice pick lobotomy was kind of through the eye socket, and it sped up the process. But lobotomies before that, they drilled holes in your skull and they severed the connection from the frontal lobe to the thalamus. So they cut your nerves so that your brain wasn't communicating the way it was supposed to be. My guess is that the people who were having lobotomies were mostly people who had horrific trauma sort of stuff in their life that caused them to be in such an unstable emotional state to start with. But there are
Right.
also stories, like there's a story about a 12-year-old boy who had it. And he actually shared his story, I think on NPR or BBC or something. I had heard it, and it
Wow.
was pretty much because like he didn't want to go to bed on time. Like his stepmom was like,
Oh my
oh,
God.
he's being
Wow.
horrific. Like, and it was just like some basic developmental 12-year-old stuff, and they gave him a
Yeah.
lobotomy. And his story is one of the
Jeez.
betters as far as how it turned out, because he lived a normalish life from there, but always wondered if
Yeah.
something was like missing. Like I think the way he worded it, which was kind of haunting, is that like if there's a part of his soul that was missing. Because of
Yeah.
that.
So it's exactly why I brought this up as a topic, because it's nice to see the advances we're making, right?
Yeah.
Whether it's in counseling or the use of as well-tested pharmaceuticals,
Yeah.
and also a better understanding of, for me, and my aspect and my thing is always to get back to nature, because it's such a healing thing to align yourself with the rhythms of the earth and the
Mm-hmm.
food, eating seasonally, getting outside and physically using the body. Because
Yeah.
to me, and I've said, my definition of health is every cell in the body on purpose. So if your leg muscles aren't feeling their purpose because you haven't gone for a nice brisk walk, run, squat, lunge, or
Yeah.
something, well, you can't expect them to really be at their optimum game. You got to wake up every part of your body. And it reminds me back of what you're saying with sitting with your emotions. That is allowing the parts of your brain to process chemically and neurally the emotions, and not drown them or distract them with either social media or alcohol and the other distractors we were referring to earlier. So yeah, I think we need to celebrate the idea that we're going in the right direction. You just think of the idea of mental illness, to saying that I have it was such a stigma. When I was a child, if someone was diagnosed mentally ill, like the woman down the street, she's mental, there was this thing where we better not even, look at her house. She might, something terrible could happen, not just to us, but maybe to her. We want to scare her, everything else. And all this woman had was a bit of she was diagnosed with some anxiety. She's a wonderful person. As I got older, I got to know her. And I thought, okay, so how is she really mentally ill? I didn't understand how she could be labeled something that at that point was considered something intense. And only to find out within about 3 or 4 years that just about everybody has some kind of phobia, or what we might say is mildly mental ill, depending on how overdiagnostic or fussy you get with the definitions. And then it became like, okay, well, when is the problem? Like we said earlier, anxiety is fine, but anxiety disorder gets, some credence when it's affecting your daily life, and you can't do daily things because your anxiety is controlling you, right?
Well, and almost all of our diagnostic criteria kind of says like the last one is like, and it's impairing your ability to function socially, in your work, social or family life. Like it becomes a problem when it's impairing your ability to function. But you're absolutely right. I think that the movement of mental health care has become more and more holistic. There isn't this bubble of like your physical health and your mental health, and to get a little out your spiritual health, but we'll do physical and emotional to start with, right? They aren't separate. They're super enmeshed and super entwined, and we cannot be wholly healthy if one of those is off. And then it impacts the other one. And we've also become just so much more person-centered in our care. And what I mean by that is like seeing the client, the patient, depending what field you're in, as a whole picture, right? Everything, their experiences, their personality, their not just their symptoms. And I think that the stigma has reduced dramatically for things like anxiety and depression. I think it is still really there from some of the more severe pervasive stuff like bipolar disorder or schizophrenia. We're often very afraid of schizophrenic people, and the reality is most schizophrenic people are not dangerous at all. In fact, they are often victims of stuff. They're often taken advantage of, and they're terrified. And so I think we still got some movement as far as the stigma goes. We've still got some places to go, but we're getting there. And we really
the labels. As I said, the labels, are dangerous in any field, I think. But at the same time, knowing that someone has a propensity for maybe anxiety, I may spend a little more time discussing something a little more carefully to them that falls into something that normally would cause anxiety. And I don't think there's much harm in that, as long as I don't overdo it, right? And put the person in some kind of box or something, But the label is. I think the label is
safe. It's good, right? Like all the time.
Why not? It sounds like the right way to proceed as a human being. One of the things I definitely want to talk about is EMDR. Give us your definition of it, how it works, because the first time I heard about it, I got really excited, and I actually was thinking getting trained in it. And then I had heard that it was really kind of a specialty field for counselors. And so define what it is and how it works.
So EMDR is a very intensive training with lots of stuff, and I am going to not be able to do it justice right now. But what it is it's a therapy approach. It's a trauma approach for therapists to use with their clients. EMDR stands for eye movement desensitization and reprocessing. It's an 8-phase process of kind of like learning about the trauma history, preparing the patient, giving them lots of coping skills to be able to manage their emotional state, and then like setting up and doing the actual processing, scanning your body and reevaluating. So kind of like or installation of positive stuff. So you're going through one memory at a time of the traumatic things that happened to you. It is to add to your comment about vets committing suicide. PTSD is just so common among our veteran population, and EMDR is an amazing tool to help with that. I know that the VA here has EMDR trained therapists. I know it's available to vets here, but I don't know that everybody knows that, or that that's a thing. So what we do is, and the premise of it is, when a trauma is happening, and I'm not going to use a specific example so as not to trigger anybody listening to this, but let's just say something really traumatic is happening to me. You know, it's starting to come in, my senses are experiencing it, starting to come into my brain, and my brain kind of stops it. And it's like, whoa, 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 that is too much. We can't process that right now. And we just kind of like take it and like shove it behind a wall because we need to survive, right? So like whatever it is that's happening. And it's kind of fine there. We continue to survive, we get through that event. And if we don't process it, it stays there. And then maybe something pushes that little wall and stuff spills over. So as an example, I might be triggered by a specific smell that reminds me of a traumatic memory, or a sound, right? I think about like people who've been in war-torn countries, and like this is old school, but like if a car backfired, that noise would sound like a gun and they'd be terrified, right? They'd be back in the emotional state. So just a little bit on trauma, like sometimes trauma is we're having a flashback and we're fully there, we're seeing things as they're happening, but sometimes they're emotional flashbacks. Sometimes we're just experiencing the emotion of being back there because something triggered us. So what EMDR does is it allows us to take one little piece of that at a time, process it, and put it away. Very simply, to oversimplify it, your therapist would take her, you can't really see it, you would take their fingers and like move their hand, and you would follow with your eyes after doing all of this setup with your traumatic memory. Lots of prep work. It's not as easy as just that. You can also do alternating tones or tapping, like tapping on your knees, or even like across your chest, to create a bilateral stimulation. Some of the theories about why that works is that it's engaging, you're able to touch on the memory while keeping it distant. It's not as overwhelming as if you were there again while you're processing it. You can keep one foot here and present and one foot in the memory, so you're not slipping all the way back there. Engaging both sides of your brain, both sides of your body. That is a really quick summary. It's an amazing therapeutic tool. I recommend it to people who have traumatic pasts, whether that be long-term chronic trauma or acute trauma, like I was in a really bad car accident and now I'm afraid to drive, or things like that.
Okay. Yeah, I think that's a good definition. When I read through it, it got thick, like you're saying, and but I thought it was I just love knowing the concept that, because body stimulation and memory are something that as chiropractors we're quite aware of, because you're adjusting people's backs and they could have been abused in different areas that you're working on, and you can wake up a lot of tension. And it's great when they can recognize that and work through it, and they see that I'm, in a sense, creating a healing situation where they once had an abusive situation, and that can be something that can work it out. A lot of people are, struck in the head and neck in assaults, and those areas they come in with. Sometimes they outright say, I was assaulted and this is why my neck and head are the way they are. Other times it's multiple things over years, and then they come in with like a just plain headache and they're not sure what it is, and we're waking up a lot of memories. And it's nice to be able to say that there's technology out there that even goes another step further in training the eyes. And you think of how strong the visual field is, and how much data comes in through the eyes. To use those as ways of changing neurology and physiology is brilliant. And I'm glad it's out there, and glad you're doing it.
Yeah. Oh,
how often do you do that? Is that something you do daily, weekly?
Well, I mean, it depends on each person and their story and all the stuff that needs to be worked on. I use it in my practice daily, but that might mean for one patient, that
Mhm.
might mean every time I see them. And for another patient, it
Okay,
might not. We might kind of go in and out of different techniques and approaches.
sure. How often, another question is, how often do you work with substance abuse and how do you approach that? Is it a
So
direct or sort of an indirect?
yeah, so I don't do a ton of direct substance use work. Like if somebody is actively in an addiction, that would often go to somebody who's specialized in that field. However,
Gotcha.
I do have a handful of people who have what I'm going to kind of consider like manageable substance use issues or are in recovery and want to do the work on the things that got them there. And that's, again, with that trauma approach, that's where I go. The client that you told us about earlier who started drinking at 13, his story didn't start at 13. Something got him to a place where he needed to use alcohol to numb
Hmm.
himself at a really young age. So my approach is, well, what's behind that? What were you using the alcohol to
Gotcha.
numb? And so
Hmm.
kind of going to that approach. If their substance use is making it so they can't hold a job, if they can't, like they need to see somebody who's more specifically trained.
Yeah.
But I just, substance use, just like everything else, I just look at, well, where did that come from? What are you trying to
Yeah.
fill
Heal the
with that?
wound.
Yeah, what need are you trying to fill?
He'll go back. Yeah.
Yeah.
Okay. That's fair. One of the buzzwords today is mindfulness. And when I
Mhm.
first heard that, I kind of just went through it like, okay, you're just, being in the present moment or whatever. And it seems to become even more popular
Mhm.
as a concept. Talk about that. How do you utilize that word? People come in and request they want to become more mindful, or is that something you say, hey, I think we can solve this problem using mindfulness? Give us some
Yeah.
ideas on that.
Yeah. So I think that's a really good definition of mindfulness, is like the the learning of how to be present in this exact moment,
Hmm.
um, being connected to my thoughts, my feelings, my body, and doing so without judgment, which is probably the trickier part of the equation.
Hmm.
But really pulls back to that earlier thought of like, well, feeling sad isn't something I should feel judgment towards myself about, right? Sometimes sad is the feeling I should
Hmm.
be feeling, and I need to experience that. And can I do that? Can I experience it without judging myself for that? And there's a lot about our childhoods that usually kind of put that judgment on certain feelings. But I use mindfulness often. Very few people, I think, come to me and say, oh, I want to learn how to be more mindful. There's an approach to therapy called dialectical behavioral therapy. It's an extensive, very structured program that's wonderful. It teaches lots of skills, and mindfulness is an entire module in it. So there's a lot in
Hmm.
there to really help
Hmm.
people learn to manage their emotions, right? Help them to be able to function really well. So if you think about it, we can all recall a moment where we're mindful with a really pleasant experience. You're sitting on the beach on your honeymoon with your new spouse and you're watching the sunset, and you know, you can feel the breeze and you can see the beautiful
Hmm.
scenery and you can, smell the ocean air and like all of that, right? We can all,
Hmm.
we
Hmm.
were very mindful. We were very present there. But when we want to do mindfulness fully, can we do that with the unpleasant moments too? Right? Can we sit in that space with the feelings? I don't believe that feelings are positive or negative. So when I slip into those wordings,
Hmm.
it's me making an error. But like, can we slip into those places with
Hmm.
the feelings that are a little bit more uncomfortable? You know, um, I have a really big exam or a big presentation at work or something like that, and I'm feeling unsettled. I'm feeling a little anxious, a little nervous. Can I just notice that and not judge it? Can I say, oh,
Hmm.
I'm just feeling that? My stomach is a little like unsettled, or oh, my chest feels
Hmm.
really tight. I'm noticing that. I'm thinking that I'm going to fail, right? Like I'm noticing all of it. I'm noticing myself and being okay with that, being like, that's just what it is. A really great example of this is if I were sitting on a big rock at the side of the thruway and I'm just watching cars go by, and I'm just watching cars go by. I'm just watching them. Look, there's a blue car. Look, there's a red truck, right? And I'm just observing. I'm just noticing. I'm noting it. I'm not
Hmm.
judging the red truck. I'm not saying, oh, that's a bad red truck, or,
Hmm.
just kind of
Okay.
sitting and experiencing and watching our thought process, watching our physical sensations.
Yeah, yeah. I think when you talk about that, it reminds me of a meditative instruction someone gave me one time to work with equanimity, to work with the idea that nothing is massively bigger than me and nothing is incredibly smaller than me. So it
Ooh.
takes like some of the judgment out of what you're doing, even with your own actions. That this is just what I'm feeling right now, and it's kind of painful, and it'll pass, and and I'm going to be fine when it's over, and I'll probably grow from this.
Mhm.
And so welcoming the uncomfortable things that are going to lead to growth. And
Yeah.
one of the other things that I work with, and I tell people to do, and I see people lose their ability to do, is just simply put something in perspective. I saw a study one time where they said people are more afraid of public speaking and have more anxiety and fear and thoughts about public speaking than they do death. So
Yeah.
it's actually they're more. Some people would rather be dead than public speak, and it's such a common phobia, and it's
Mhm.
something that most of us share when we first do something like that. Some people are just born for the stage, but it's something that I think as we get through something that terrifying, we then grow. We have a new skill set. We can public speak. And
Yeah.
to put it in perspective, I always think of, how bad is this that what I'm going through? I mean, relative to big things,
Mhm.
illnesses, loss of loved ones, the
Mhm.
big, horrible things. What I'm doing, what I'm feeling at that moment, let's say, is so tiny. Just take a breath and proceed
Mhm.
forward and do the best you can do and grow from it, or celebrate that you pulled it off. If you
Yeah.
didn't pull it off, you're going to learn, right? And I think people should focus on what they're going to be learning as they're sharing a little bit more. To me, that helps me. I'm just sharing what
Yeah.
helps me
Yeah.
personally. Is I would think this is painful, but boy, I've just figured out a lot of stuff about something. And
Mhm.
like I'm more informed now. I'm more sensitive now.
Mhm.
I'm more empathetic. Because I've
Yeah.
just experienced something. Now I know what that feels like. That's no fun, and I can when someone else has been through it, I can say I walked in those shoes a little bit, and I feel for you, and it creates a connection. Then I
Mhm.
have another human being I'm making a deeper connection with because I have suffered in the same way they've suffered. You think of war buddies. Why are they so deeply entrenched? And my father had friends from the service that he had relationships with. They're very deep, and it was
Yeah.
because they suffered together, and
Yeah.
that connectedness that suffering can bring.
Mhm.
It's an interesting concept if you think about it,
And
right?
the meaningfulness of that,
Hmm.
right? Like there's so much meaning
Hmm.
behind that. Absolutely.
And I think when people get distracted from the depth of relationships, obviously the quality of life goes down. And I think of the concept of being in the present moment, being here now.
Mhm.
When someone is talking to you and they're completely focused on you, it's a nice experience. If they're checking their phone, looking over your shoulder, daydreaming, going, "What'd you say? What?" It's not a great
Yeah.
experience at all. And that's what's happening in social media. Not just that
Yes.
you're talking to someone and you're on social media, but you're on social media, you're not there. You're in the right moment, but you're not in the right place. You're not physically there, experiencing the smells and all the um, other sensory the other sensations that would
Yeah.
occur to you if you were in that person's company. Instead, you're through this device, and that creates a barrier that it lowers the quality of the experience. So, I mean,
Yeah.
being in the present moment, being here and now, I think is certainly the ultimate experience. Anything short of that, I think people should recognize as not being as real. And I think we forget that. I think we all
Yes.
know that, but I think we forget that. You know.
Yeah.
So,
Well, I mean, it's the same thing like you were saying
um,
with the social media. Like
yeah.
we have to draw that line between like
Hmm.
reality and not.
Hmm.
Yeah.
One of the things I heard you kind of say was about spiritual development. You
Mm-hmm.
mentioned, that. And one of the things I get into when I talk to patients is I don't want to scare people by talking about religion.
Mm-hmm.
It's gotten such a bad name, the word and the idea. but we talk about faith, and that's less scary for people, it appears. And then
Yeah.
we'll talk about beliefs, and all the semantics and the meanings of these words today are really it's a frustrating conversation at times,
Yeah.
because I just want people to be able to have some belief and some understanding of the depth of complexity of the creative force of the universe. And when you to do that, you can simplify it with word God, or you can get really complicated and talk about vibration and matter and changes in DNA through sunlight and go off in these crazy, like you were saying, existential tangents. But to what degree do you bring spiritual development, or what do you call it when you want someone to work in that area? Because I know in AA there's a lot of spiritual development, and I've seen that work tremendous with friends and patients that have been through that program. How do you work with that in your counseling?
Yeah. Well, to answer the question about how much, or depends on where a person is, or if that's something they want, or if it's something that I see that there's a huge amount of resistance to. And when there's a huge amount of resistance, I think there's something behind it, right? So if somebody's really pushing, if every time I see them they are like, really angry about, we'll use the term religion, but a religion or a religious group of some sort. I think there's something there, and I think we need to kind of explore that and delve into it. I think that just like our physical selves and just like our emotional selves, our spiritual selves need to be fed and grow. And that's my personal opinion, and that looks different for different people. I have clients who are Muslim, I have clients who are Christian, I have clients who are atheists. I have I'm not there to faith, like put my beliefs on you, but I want to work through what your beliefs are for you, and how that impacts you and how that impacts your growth and development, how that shapes how you do life, right? Because when your faith system is important to you, it impacts your day-to-day stuff, for the most part. So, and then I also see a ton of trauma that is associated with religious experience, right? Whether it was, nuns disciplining at a Catholic school, or somebody who grew up in a religious family but is gay, or, the church group that somebody was involved with hurting somebody, or, betraying them or whatever. Like, there's so much connection, because the reality is any faith system is made up of people, and people are flawed and broken and beautiful and complicated. But like, when we're dealing with people, we're going to come across those sorts of things. And so healing from those wounds so that you can explore and decide what is yours and what is not, instead of just taking what you were taught as a child and just clinging to it without it becoming your own. And that is, I think, something that everybody needs to work through at one point in time.
Yeah. I think when I think of religion, I think of sort of men and women telling me what God is, and spiritual development is me figuring out what God is.
Yeah.
And that to me is they both are, I think they both can be very necessary, because if I don't have any idea what's going on, at least man or woman tell me, hey, here's some basic ideas that I believe, and here's a book with a whole bunch of really amazing stories in it that we believe is the word of God himself. So you should probably read this. Okay, well then I read this and I find it to be amazing. And I think, okay, well I still have to figure out how I'm going to work with this to be at peace with fellow man and myself, and grow and behave and do the right things. I've always been in love with ancient wisdom. So for me, if an idea is old and it's time tested, the results are really good, well, even if it's not the easiest thing to pull off, and it usually isn't, like most discipline, it's a good thing. I don't want the easy road. I want the right road. I don't care if it's a difficult climb. I just want to make sure that it's the right climb. And for me, that's a lifetime journey, and that's spiritual development to me. And that's the road I'm on, and the road I try to encourage people to be on. But let's just say, give us 3 tips to keep us on track. Like if you think of how often people fall off, they probably fall off in a multitude of ways, but there's probably some that are bigger than others. And give us some ideas, some little take home, maybe some homework, or at least a couple of concepts, maybe 3 concepts that people can take and say, hey, that's something I'm going to work with now. That's my homework.
Okay. Well, I think the very first is that we are connected to ourselves. We're not those buckets, like I was saying, right? And so one of the best things you can do for your emotional health is to take care of your physical self through self-care. And self-care is one of those catchphrases right now too. So I want to be really clear on what I mean. I'm not against bubble baths and chocolate cake. That's wonderful. But when I'm talking about self-care, I am talking about like that deep down, I am going to take care of this entity that I am, right? And that's multifaceted. I'm going to nourish my body with good food. I'm going to move my body because it is made for movement. I'm going to get good rest, because think about when one of those things is off. There's so many studies about, like, if I were to have an iron deficiency or a vitamin D deficiency, how much that impacts my mood. We know now that our gut health is completely, directly indicative of our mental health. It's like we have studies that show it now. This isn't, so if we're not doing those things, if we're not taking care of those things, we cannot be emotionally healthy. So when I say self-care, I mean like the hard self-care. I mean the like choosing the leafy greens. I mean, like I mean really saying, if I love myself, what would I do to take care of myself? Right? What would I do? Movement, sleep is so important. Think about when we're tired, like how emotionally stable are we when we and I'm not talking about like, oh, we got a little less sleep. I'm talking about like we're sleep deprived for weeks on end. We snap, we're nasty, we have a short fuse. Our window of tolerance, our ability to handle things just kind of shrinks down, and we can't anymore.
Absolutely.
And so my very first tip to people would be to take care of those things, take care of that, because those are really, they're not easy to implement, but they're simple and they're practical. It's not that deep level stuff, right? Like, and again, I'm not saying don't ever have the chocolate cake. I'm just saying like your holistic health needs to be taken care of from that nourishing point too.
Gotcha.
We're also connected to others. And right now, especially during this crazy year and coronavirus and quarantines and all of that, that's been severed. That those connections have been cut. People are lonelier than they have ever been. And we need human connection to be okay. We need that. Like our body releases that oxytocin in the connection with an intimate other, right? So those deep, meaningful relationships, nurture those. Now that we have some less restrictions and we can get outside more, go for walks with loved ones, go for coffee with, get out, connect with people, and don't just have the short, small conversations. Have the real conversations. Connect on that level. Like, man, this year has been really hard. Yeah, it has been really hard. Like, hearing and validating each other, there's healing in that. So that's just really important. So really nurturing and fostering those healthy, positive social connections, and then putting boundaries in place for the ones that are more draining, and some of the boundaries would be social media appropriate. Stop following people who are draining you emotionally. And if you're scrolling and you see crazy Aunt Susie, I keep using the name Susie today, you see crazy Aunt Susie making like a post that really upsets you, and you feel yourself hit the little button and stop following her. Don't, put really firm boundaries in. If somebody is really draining, if somebody takes from you but doesn't replenish you, limit time with them, right? Put those boundaries in place so that because we have so little social interaction, it can't be draining. We don't have time for that right now.
Right.
Get connected. volunteer somewhere. I know that that's been cut down dramatically, but there are places where you can kind of start, you know, connection to that meaningfulness, that purpose, but also connection with people in that setting. So these are very big tips. And then my third tip,
No, it's fine.
really,
You fleshed them out. You fleshed them out well.
my third tip is really in line with that growth mindset, really focusing on what you can learn. When we're born, we have a growth mindset. We are wired to learn when we're born. And the system and attachment stuff and everything kind of cuts that so that we don't keep that desire all of the time. So what are you curious about? What do you like? You know, I know a ton of people started saying things like, I'm going to pick up a hobby during this pandemic. And they did for like a little bit, but then they didn't. You know, they started and then they stopped because they didn't find something that really captured them, right? So they started, maybe they said, oh, I've always wanted to learn classical piano. But the reason they didn't learn classical piano when they was a kid was they really didn't actually like it, right? Maybe they want to learn about, you know, rocket science for real, right? Like maybe they want to, we have infinite knowledge available to us now. And back to the good purpose of technology. Start getting curious, start having a growth mindset. What can I learn? How can I learn from this situation? Really kind of just like shifting with like, oh, like, and maybe it starts with emotional intelligence. Maybe that's a place where you're saying, you know, you're listening to this conversation and it's like, no, that doesn't feel right. You know, that doesn't sound good. You know, learn a little bit more about stuff. We learn emotional intelligence the same way we learn everything else, by being taught, by experiencing it, by you know, watching our grown-ups when we're kids. And so we don't all learn it. Most of us don't learn it until we're intentional about learning it. So be intentional about just growth in that area.
Yeah.
And then
I think those are great pointers.
My bonus tip is that absolutely everybody at one point in time benefits from seeing a therapist. It might be really big stuff like the trauma sort of things that we were talking about. It might be, I'm just really having a hard time navigating right now. You know, or I just went through a really big loss and I'm stuck here. I'm not moving forward. So don't hesitate to reach out, look for a local therapist, look for somebody who you connect with. And you know, it feels like a really scary step, but it's always a good step to say, okay, I want to work on this. I want to get better at this. I don't want to stay here anymore.
Well, I think a lot of people have sort of that relationship with a good friend or a parent or their spouse, and they don't realize that they're kind of getting some counseling, but maybe going to the next level with a professional that really knows how to disseminate and show you things, that's trained. Obviously, someone trained is going to be less bias from the point of your friends and your spouse and that kind of thing, which are obviously tremendously important relationships. But in the counseling world, or or maybe you still feel off and you want to go to the next level, that would be the place to go. See somebody like you, and maybe we can put some names in the links that you can share with us, that they can, you know, for different, maybe a couple different areas for different age groups or different issues, so people can draw from that.
Yeah, absolutely. I can, psychologytoday.com, you can search for therapists in your area. And it's really amazing because you can search by like area of expertise or specific, like if you're looking for somebody with EMDR training, you can search there. You can even put in your insurance so you can find somebody who takes the insurance you have without having to, you know, make hundreds of phone calls trying to track that down. So it's a great tool.
Another advancement for technology, right? Yes. Just click it in the computer and you get the ultimate therapist that fits you perfectly. Yes. Well, Jessica, thank you for coming on today. I think we covered a lot, and we hopefully shortened it up and made it concise and digestible for people. But I think it's our mental health is crucial. It's connected to our physical health, like you said a second ago. And I always try to get that message across. Let's do it all. Let's get counseling. Let's eat our vegetables. Let's find the purpose in our lives, and so we can live a full life and be good examples to those around us. I remember one of the most powerful things about having children was I wanted to be someone that they looked up to and said, you know, my dad is something, you know, he's got this going on, he's got that going. It made me want to be a better man. And that's such a powerful force in my life. They are, and whether they know it or not, but it is something that I think it all should call us to be the best human beings we can be the most, efficient and the most effective people, and be loving, caring, and be part of society, be part of what cranks the wheels and gets everything going. I always use the bee's nest as a good example. Not that those bees aren't all equal, but they all have their task and they're all doing what they're meant to do. And I think when we find what we're meant to do, like you did, to be brave enough and to say, you know what, this isn't what everyone said I should do. It's not what I'm just naturally good at even, but it's something I really want to do. I had a neighbor that made picnic benches. He did them incredibly well. He actually hated making them, which I thought was hilarious. He had all these other great hobbies, but he made these amazing picnic benches that you pulled the center and it folded up and it had wheels and you can wheel it around. And I thought, oh, he's in his passion, and he wasn't. So sometimes people are doing something you think it's passionate because it's kind of cool, like picnic benches on wheels, but he didn't really like it. But I don't know why he was making them. Maybe he felt peer pressure or something. But so let go of the stuff you don't like doing. There's when you love something, you're so much better at it, and it's going to make you healthier. So,
Yeah,
all right,
absolutely.
Jessica, thanks again. I appreciate your time. I think we
All
did
right.
a good one today. So we'll talk soon.
Sounds
Take
good.
care.
Thanks for having me. Bye.